Sir, you can start, sir. 1 minute, sir. So you can start.
Good evening. Welcome to 90-day University Prof pre-final mastery program from Auricle. Today we'll be discussing about preventive medicine in obstetrics, pediatrics, and geriatrics, session 1. And welcome to Auricle again. We'll be providing you with all rapid revisions of all important questions, facts, and most expected topics will be covered in all the sessions for PSM. Okay, today's discussion will be about maternal mortality and what are the causes, what are the determinants of that, and how do we prevent it, and the maternal and child health indicators and perinatal mortality and measures to reduce the same. In short answers, we'll be having under 5 clinic antenatal care and health protection given to antenatal cases, that is specific health protection. Auricle provides you around 5 ways of learning, that is recorded classes, live classes, practical sessions, exam modules, and as well as hard copy book sets. Okay. In recorded classes, we'll be having flexible learning where you can do the revision as you require whenever you are free or whenever you feel like revising the topics for your exams. And 10 years experienced teachers will be giving you the classes where you can grasp much of the knowledge and the content so that you can go for your exams with full confidence. In live classes, we'll be giving in-depth coverage of 10 years past previous year question papers, most common questions, most repeatedly asked questions, and experienced educators will guide you how to write an answer so that your examiner gets impressed. And you can ask any doubts in the live classes at any time you want. In Express exam module of Auricle, the syllabus will be completed in 20 hours so that you can revise for your exams in a very efficient and a comprehensive way. And you'll be also told about how to write the answers and all the exam writing skills also by our expert examiners. You will be having one-to-one doubts clearing session where it will be a safe learning environment for all the students and it will be a student-friendly approach. If you have any small doubt, you can ask without feeling the fear of judgment by anyone. And in not the least, you will be getting the books also for revising for your exams, which contains 10 years question papers, most commonly asked questions, and you will be having MCQs also. With this, you will be getting a question bank from beginner level to expert level, where it is customized for prof exams, NEET PG exams, and FMG exams. And we have practical sessions also, so that you can go to your exams and face your examiners very confidently. You will be given all the type of coaching which you require. For that, we have 4 plans available. That is foundation plan for 3 months at the cost of 19,999, and advanced learning plan of 6 months at the cost of 32,999, and complete learning plan for 12 months at the cost of 59,999. And there is a complete ultimate plan which gives you 4 years coverage of the whole degree for 1.9 lakhs. Don't worry, you'll be getting a very good discounts. Please do use the discount codes displayed below for discounts, and please do subscribe. With this, we'll be starting our first question today for pediatric medicine, preventive medicine, obstetric, pediatrics, and geriatrics. We have a small case scenario. A 20-year-old woman is in her second pregnancy at 24 weeks of gestation. She has history of gestational diabetes in her first pregnancy, which was managed with diet and exercise. She is currently attending a routine antenatal checkup. What will be the investigations you will do? What will be the history you will take? And what will be the investigations you will do? And how will you explain the risks? And what is the advice you will give? These are the questions which will be, for which the answers will be there in the next questions which we will be discussing. Okay. The first question is, Define maternal mortality rate. Discuss the causes, determinants for high maternal mortality in India. Describe preventive and social measures to control maternal mortality. Okay. What is maternal mortality? Means death of a woman while pregnant or within 42 days of termination of pregnancy, while pregnant or within 42 days of termination of pregnancy. It could be normal delivery, it could be abortion, it could be stillbirth, whatever it is. Within 42 days, irrespective of the duration of pregnancy, that is, one includes abortion or stillbirth or medical termination of pregnancy, and site of pregnancy. It can be uterine pregnancy, it could be ectopic pregnancy, from any cause related to or aggravated by pregnancy or its management, and but not from accidental or incidental causes. What does it mean? Women is having pregnancy, she will come for hospital. There is a mismanagement during normal labor or a skilled surgical uh, cesarean section. That includes the management. A woman is going for hospital, but she met with an accident. It is not considered as maternal mortality, whereas this is considered as maternal mortality. Okay. It is expressed as maternal deaths per lakh live births. And as per sample registration system of 2020, it is 52 lakh live births per lakh live births. That is 52 is a very huge number, whereas developing countries have hardly 5, 4, 5, 6 in a single digits. And in India, it is still 52, which is a high number. This is the formula which is used, that is total number of female deaths due to complications of pregnancy, childbirth, or within 42 days of delivery from puerperal causes in an area during a year, and total number of live births in the denominator of the same area and the same year. It is in 2000 or 1 lakh. Okay. It is the definition. This is the ratio. What is maternal mortality? The number of maternal deaths divided by person years lived by a woman of reproductive age. There's difference. Ratio, there is the denominator is number of live births, whereas rate, the number of maternal deaths divided by person years lived by women of reproductive age group, that is 15 to 44 or 49. Okay. This is maternal mortality rate. This is ratio. Now we'll come to the causes, determinants of high maternal mortality rate in India or developing countries. The determinants can be classified into two types, that is medical causes as well as social factors. In medical causes, we have obstetric causes and non-obstetric causes. Obstetric causes include toxemias of pregnancy, hemorrhage, infection, obstructed labor, unsafe abortion. Everything related to pregnancy. In non-obstetric causes, anemia, associated diseases like renal hypertension, cardiac malformations, infections, malignancy, accidents, etc. Okay. In social causes, we have age at childbirth, that is age of mother at childbirth. Parity, it is first pregnancy, second pregnancy, or third pregnancy. Spacing between pregnancies, what is the present family size? Malnutrition, socioeconomic status, education status, knowledge of the mother, lack of healthcare facilities, shortage of healthcare facilities, delivery by untrained women, poor environmental sanitation, poor communications and transport, and social customs, that the mother has to undergo her first pregnancy in a mother's place, even though it does not have any healthcare facilities or nearby health facilities, but she has to undergo her first pregnancy in her birthplace only. This is the social custom. Coming to the obstetric causes, we'll discuss one by one. In obstetric causes, we have preeclampsia and eclampsia in toxemia of pregnancy, characterized by high blood pressure, okay, and which can lead to seizures and organ damage, which can go into multi-organ dysfunction also. This can cause death if it is not managed on time. Second, we have hemorrhage, severe bleeding, especially postpartum hemorrhage is the most common cause of death, and uterine rupture during pregnancy is very unlikely. So hemorrhage due to postpartum hemorrhage is a leading cause of maternal death, and it can occur during or after delivery and requires immediate medical intervention. The lady might require blood transfusion also. Okay. Again, infection, postpartum infections can be fatal if not treated. Why? There is access for the bacteria or the virus to enter the body through the uterus, which is still under repair. Okay. And how does this infection come? When the delivery is done at the villages or in the places where the sanitation conditions are very poor. Okay. Obstructed labor, when the baby cannot pass through the birth canal, or there is a, instead of head presentation, if there is a feet presentation or foot presentation, that is abnormal presentations, the obstructed labor can occur. Okay. If it is not managed, it might go into complications of the mother and baby. This requires surgical interventions. If this is not done, again, there is a cause of death of the mother. Unsafe abortion, if the uh, abortion done by quacks, basically, okay, or the medical shop people give some drugs for abortion, even without asking the duration of the pregnancy, they just give it. If the duration is more than 24 weeks, the death of mother is very high. Coming to the non-obstructive causes, anemia. Anemia might be during pregnancy or before pregnancy itself. If it is before pregnancy, it can weaken women's body, making it difficult for meeting the demands of pregnancy and childbirth. This increases the workload on the cardiac tissue. Once there is a increase in workload on cardia, it might lead to cardiac arrest also. Associated diseases such as cardiac, renal, hepatic, and metabolic infections. This can get during pregnancy due to additional strain. That is, pregnancy itself is the additional strain. Cancer diagnosed during pregnancy can increase the risk because there is increased demand. Accidents such as vehicle accidents, substance overdose, homicides. Sometimes there may be identification of the gender of the fetus. Then it might lead to accidents or homicides or suicides. This is the causes, non-obstetric causes of maternal mortality in India. Coming to the social factors, young mothers, when women are 18, less than 18 are at risk and over 35 are at risk. Parity, multiple pregnancies for the sake of male children. Again, there's an increased risk of uterine rupture and postpartum hemorrhage. Too close pregnancies, usually less than 18 months, it is very high risk. The suggested age group is at least 2 to 3 years between two pregnancies, a suggested duration of spacing. Okay. Coming to the family size, larger the family size can strain on mother's health, resources, and increased risk of malnutrition and inadequate care during the pregnancy. Malnutrition, again, increase in family size, decreased input, decreased income. All these things leads to anemia, preeclampsia, and other conditions. Poverty, explained already. Illiteracy. What does illiteracy have as a role? One, it lacks the way of understanding or accessing the healthcare services. It delays the spacing. It delays the way of taking nutrition. It affects the timely accessibility for healthcare facilities for during risks or complications. All these things are the social factors. Ignorance. This is there because of the cultural beliefs that first pregnancy should be a normal delivery. We'll try normal delivery till the end. If the normal delivery does not happen, later we'll see what happens. This kind of ignorance or attitude also leads to maternal mortality. Lack of maternity services, especially in rural areas, can lead to uh, inefficient care receiving by the mothers. Shortage of health manpower. This is all over the country. Trained healthcare professionals can result in inadequate care. This also can lead to, because if there is one staff nurse at a PH or one MO at the PHC, can't run on 24/7 in that hospital. Okay, there should be adequate manpower also. Delivery by untrained guys, that is unskilled birth attendants usually in the rural areas. Poor sanitation, again, high risk of infections. Poor communication and transport facility in case of rural areas. Social customs, again, like early marriage to reduce the burden of the family, female genital mutilation, so that all these things increases the risk of maternal mortality chances. Coming to the preventive measures, what are the risk factors we have mentioned here are the factors which are used as preventive measures. When the pregnancy happens, there should be early registration of pregnancy so that it allows for timely identification and management of potential complications for both outcome of mother and baby. At least 4 antenatal checkups to be done. Okay. Dietary supplementation, including correction of anemia, should be done during the follow-ups. Prevention of infection during puerperium and hemorrhage by ensuring clean delivery practices and postpartum care. Hemorrhage management should be done effectively, including use of uterotonics, or can prevent severe blood loss and maternal death. Prevention of complications like eclampsia, malpresentations, and ruptured uterus. Eclampsia can be treated in the early stage, detected in the early stage. Malpresentation can be detected in the last 2 or 3 weeks of pregnancy, and pregnancy can be planned for safe confinement as per the dates of expected date of deliveries. Again, treatment of medical conditions include hypertension, diabetes, and tuberculosis. Anti-malaria and tetanus prophylaxis. Malaria prophylaxis is very unlikely. Tetanus TT should not be denied to any female. And clean delivery practice, that is safe delivery by skilled birth attendants by using the sterile equipment. In India, the help of trained village health workers, that is by role of ASHAs. What does the ASHAs do? They do the early registration of pregnancy. They get the vaccination done. They follow for at least 4 visits for pregnancy, and they offer counseling support for during pregnancy and ensure timely referral, and they plan the pregnancies in prior so that the complications are reduced, so that the institutional deliveries are more, so that a clean and safe deliveries happen. Institutional deliveries for with bad obstetric and risk factors, again, especially with men with obstetric complications of risk factors, should be managed at institutional levels. High risk pregnancies always should be managed at institutional levels. Promotion of family planning to control the number of children to not more than 2 and spacing between the births. Okay, programs like Mission Parivar Vikas has been introduced to provide access to contraceptives and reducing maternal mortality. Identification of every maternal death and searching for its cause. If the incident has happened, do the autopsy of the incident and find out the cause. That is systematic identification and review of every death to find out the cause. And safe abortion services as per the MTP Acts. illegal abortions do happen in India, but they should be identified and to be curbed, and ensure that women have safe access to and legal abortion services, which can reduce these risks. Okay, these are the preventive measures. Early registration, at least 4 checkups, dietary and supplementation, prevention of infections, prevention of complications, treatment of medical conditions, prophylaxis, clean delivery practice, and role of ASHAs, Mission Parivar Vikas, institutional deliveries, and identification of causes and safe abortion services. These are the points which you have to remember in prevention of maternal mortality rate. This question will be asked in Viva also. Coming to the next question, enumerate the maternal and child health indicators, define perinatal mortality rate, write the causes and measures to reduce perinatal mortality in India. Okay. Maternal mortality ratio. We have already read about this. This is one ratio. And mortality in infancy and childhood, which includes perinatal mortality, that is 28 weeks of gestation to 7 days of birth. Neonatal mortality, that is from day of birth to 28 days. Post neonatal mortality rate, that is from 28 days of birth to 1 year. Infant mortality rate from day of birth to 1 year of age. 1 to 4 year of mortality rate, under 5 mortality rate, and child survival rate. These are the indicators. Coming to the perinatal mortality rate, as per the International Classification of Diseases, perinatal period is lasting from 28th week of gestation to the 7th day after birth. That is, here it is. This period is perinatal mortality from 28 weeks of gestation till 7 days after birth is perinatal mortality rate. Perinatal mortality. How it is calculated? Late fetal or early neonatal deaths weighing over 1000 grams at birth, or divided by total live births weighing over 1000 grams at birth into 1000. This includes stillbirths also. Okay. What are the causes? Causes can be divided into 4 categories, that is antenatal causes, intranatal causes, postnatal causes, and unknown. Antenatal causes, there are maternal component involved: hypertension, cardiovascular diseases, diabetes, tuberculosis, and anemia. Hypertension, again, eclampsia and preeclampsia can cause. Diabetes, again, it may cause hypoglycemia and death. Tuberculosis, infection. Anemia, again, it has own risk factors. Sorry, it has its own consequences. Pelvic diseases like uterine myomas, endometriosis, where there's a growth of fetus is reduced. And blood incompatibilities are risk factors. Endocrine imbalance and inadequate uterine preparation, anatomical defects of uterus, incompetent cervix. Okay. Malnutrition, toxemia of pregnancies, antepartum hemorrhage, congenital defects, advanced maternal age. And in internatal causes, injuries during birth, asphyxia, prolonged effort time, that is delayed delivery time, so that the kid is deprived of oxygen for a longer time, which leads to death, and obstetric complications also. Postnatal causes like premature delivery, premature births, or preterm deliveries, respiratory distress syndromes, respiratory and elementary infections, and congenital anomalies. Unknown causes like accidents, suicides, homicides, etc. What are the measures to reduce perinatal mortality in India? It can be divided into 4 ways, 4 broad classifications: before and during pregnancy, during and soon after delivery, and during first month of life. In the first month of life, it is again first week of life. Before and during pregnancy, delayed childbearing, that if the age of the woman is less than 18, please do delay to at least 21 years. Well timed and well spaced unwanted pregnancies. Well timed, again, according to the age, well spaced. If the child is of 1 year, please do not go for second pregnancy. If the child is first year, 1 year of age, wait for at least another 3 years for the second pregnancy. If it is a failure of pregnancy, please do encourage for MTP. If it is a failure of contraceptive, well-nourished and healthy mother, treat the mother for anemia, hypocalcemia, all the disorders, hypertension, then ask the mother to conceive. Free of drug abuse, tobacco and alcohol, tetanus and rubella immunization during the pregnancy, prevention of mother to child HIV transmission, and educating the female before the pregnancy about pregnancy and the associate factors with it. During pregnancy, early registration of pregnancy, and emergency preparedness. Emergency preparedness, it does not mean that preparedness only for the complicated or high risk pregnancies. Emergency preparedness for all pregnancies. It includes where the lady will go for delivery, at what time, which hospital, who will provide the transport, where the transport will come from, and how long does the transport take to come. All these should be planned. This is called preparedness. Early detection and treatment of complications, monitoring of fetal well-being, and timely interventions of complications, tetanus immunization, prevention and treatment of anemia, treatment of infections like malaria, hookworm, syphilis, voluntary HIV testing, and prevention of mother to child transmission of HIV. Apart from this, good diet. Good diet solves so many problems during pregnancy, and it gives the good weight for the baby, so that increasing of 50 calories per day during the pregnancy will increase at least 300 grams of the body weight of the baby. So appropriate and adequate nutrition should be provided, which includes micronutrients also. During and soon after delivery, safe and clean delivery by skilled attendant. If there are any problems, prompt management, emergency obstetric care for maternal and fetal conditions. We saw essential obstetric care and emergency obstetric care in RMNCH, which covers all these aspects to prevent all these things. Newborn resuscitation, newborn care for ensuring warmth and cleanliness, cord care, eye care, and skin care of the baby, early initiation of exclusive breastfeeding, and soon after delivery, avoiding to give the syrups like honey, sugar syrup, honey, goat milk, donkey milk, all these things should be avoided. Early detection and complications of treatment of the newborn, special care for infants, for preterm and underweight babies, prevention and control of infection, again HIV, information counseling, all these are educative part. Okay. During the first week of life, early postnatal contact by ASHA workers, protection, promotion, and support of exclusive breastfeeding, prompt detection and management of diseases in the newborn infant, immunization before discharging the mother and child to home. Protection of girl child is important, because if it is second pregnancy or third pregnancy or fourth pregnancy and all the children of first, second, third, fourth are females, again the fifth child is female, the risk of parental mortality is high in them. Okay, hence this should be taken care of. Protection of the girl child during the first month of life. Okay, we'll just have a fast recap of second question. Indicators are this: maternal mortality ratio, maternal mortality in infancy and childhood, which includes perinatal, go as per the age. Okay, perinatal mortality, neonatal mortality, which is early neonatal and late neonatal mortality, infant mortality, post neonatal mortality for 1 year. Later that 1 to 4 years, under 5, and child survival rate. These are the indicators of maternal and child mortality. Okay. Causes you have seen 4 types, and how to reduce this again of 4 classifications: before and during pregnancy, during and soon after delivery, during first month of life. Okay, this is all overlapping. but please do give the classification. Okay. This is during pregnancy, during and soon after delivery, and during first month of life. Okay. Next, we have short answers. Coming to the short answers, we have under 5 clinics, aims, objectives, main activities, and benefits. Under 5 clinic can come as a short essay also. It is a very common question asked for short essay and short answer. So I've a little bit elaborated this question. We'll see one by one. Okay. And what is under 5 clinic? It is a center where preventive, promotive, curative, referral, and educational services hold the hand of 5 preventive, promotive, curative, referral, educational services. All the 5 services are given under this under 5 clinic. This is what is under 5 clinic means. Okay. Under 5 is the age group, not the points. Points are also 5 only. Okay. What is the goal? To provide comprehensive health care to young children in a specialized facility. Okay. What there's a logo for this. It is a triangle within a triangle. Okay. And the inner triangle has again 4 triangles. The inner triangle, which has 4 triangles, which represents care during illness, adequate nutrition, immunization, and family planning. These are the 4. And outer triangle represents health education. Okay. This logo to be drawn, otherwise the getting marks will be very difficult. Okay. So first we'll talk about what is under 5 clinic, then you'll give the goal, then you will write the logo so that you will get at least 80% of the marks here. Whatever you write after this is your bonus. What does care in illness mean? Children are treated for acute and chronic illness, okay, and ailments of growth. Nurse, the staff nurse or the A&M, they can play a very good role in identification of the sickness and taking care of them. Whether they require referral, the referral services are also provided. Okay. Apart from care in illness, there is a growth monitoring is done. When the growth monitoring should be done? Ideally, it should be done every month. It's the most important function of the clinic. Okay. In the first month, it is every month, every 2 monthly from 1 to 3 years of age, and every quarterly from 4th to 5th year of age. Okay. First year it is every month. Second year to 3rd year age group, second and 3rd year age group, it is every 2 months. That means 6 visits. And from 4th to 5th year, 4th and 5th years, it is only once in 3 months that will be having 4 visits. First year it is 12 visits, second year it is 6, third it is 4. Okay. What happens in weight monitoring, growth monitoring? Weighing and measuring height, mid-arm circumference is also measured. So by the trained manpower. Okay. The growth is plotted on the growth chart to assess the growth of the child. There is a separate growth chart for males and females. Again, growth chart itself is a short answer or a short note. You will have to give what are the, when the growth chart was launched, what are the different types of growth charts are available in the market. Whether it is only from India or IMNCI growth chart is there, or WHO growth chart is there, UNICEF growth chart is there. So many growth charts are available. IAP follows something else, and government follows something else. All these will be given in growth charts. Next, we have preventive care. That is by immunization, nutrition care, and oral rehydration therapy if there is any sickness or diarrhea or acute diarrheal diseases. Family planning, when the mother comes with the children, with their children for monitoring of children, mother is also provided with family planning services. She'll be counseled and given the merits and demerits of all the choices of family planning. Why? Mothers are more receptive, or acceptance rate of family planning is high during her first year of lactation, or first year of life of the birth, or second year of the age of the child, because she'll be having the responsibility of taking the care of the child and the house also. So she will tend to accept the family planning method, that is the contraceptive method. Next, we have health education. This is used to educate the mother about childcare, breastfeeding, nutrition growth, immunization, and cleanliness. Okay. All this, what is 5 clean practices? Washing hands before feeding, before taking food, wash hands after taking food, wash hands before feeding the child, wash hands after cleaning the child, wash hands after disposing of the soiled clothes or diapers of the child. These are the 5 times where hand washing to be done, that health education should be provided to mothers. Okay. Before going to the next question, we will just see whether we have MCQs polls for today. Yeah, we have one. I've started the poll of MCQs at around, we'll be having 10 minutes for this poll. Okay. Later we'll be seeing what to do with this. Now we come to the next short answer, that is antenatal care objective components and essential elements. What are the objectives of antenatal care? Antenatal care: to promote, protect, and maintain the health of the mother during pregnancy. Promote, protect, and maintain. Lady has come with pregnancy. Promote, protect, and maintain. Please do remember all these words. To detect high risk and give them special attention. After first they have come for early registration, that time you will promote, protect, and maintain. While doing this, if you detect any high risk, you give them extra time to detect what is the high risk. And because of this high risk, if any complications are there, you identify those complications and again treat them to prevent them. If there is a hypertension, treat the hypertension to prevent the preeclampsia or eclampsia. Okay. And if it is pregnancy, first pregnancy, the mother will be anxious, and that should be solved. To reduce maternal, infant, and mortality and morbidity by doing all these things. Okay. Now you have stopped the, you have, what you say, you have curbed the maternal and infant mortality and morbidity of the child. The safe deliveries happened. Now you tell the mother the elements of childcare, nutrition, and personal hygiene and environmental sanitation. Childcare, breastfeeding, nutrition, again, exclusive breastfeeding, personal hygiene, so that there is no infection of the child, and environmental sanitation is taken care of, so that the hygiene is good. And now the first pregnancy has been finished. The woman is, the lady is having the first child. What do you want to do next? Now you sensitize the mother for family planning by giving contraceptives. If there is any failure of contraceptives, again, tell them about the availability of medical termination of pregnancy, and to attend under 5 clinics accompanying the mother, so that they get all these services. Okay, these are the objectives. Coming to the essential components, regular checkups. What does that mean? At least 4 antenatal visits, including early registration and first visit within the first trimester. This is bare minimum which has to be done. Okay. Coming to the screening and tests, blood grouping. What does blood test also include? Glucose challenge test, glucose tolerance test, fasting blood sugar, postprandial blood sugar, blood grouping and RH typing, screening of conditions like gestational diabetes, thyroid disorders, HIV and syphilis, all these things. Okay. Nutritional support, provision of iron, folic acid tablets for at least 100 days by Government of India, calcium supplements, and nutritional counseling. Immunization, tetanus toxoid was given initially, now tetanus diphtheria has been given. The schedule is to give 2 doses 1 month apart. If not immunized previously, if immunized previously, then it should be given 1 dose. This will be discussing in the next class tomorrow. Okay. Health education about the healthy lifestyle practices. If the lady is pregnant, she can't sit and booze every day. That is wrong. And she can't smoke. Okay. And breastfeeding, the advantages and importance of uh, exclusive breastfeeding, how to wean off the breastfeeding, all this to be explained. Okay. Management of high risk pregnancies by early detection, follow up, and management of risk. Mental health support by giving the psychological support. If there are any other mental health issues, please do screen for them. That is like depression, anxiousness, and postpartum psychosis. One of the things which has to be given importance for. Birth planning and preparing for emergencies, like where the birth will happen, whether in hospital, which hospital, what time, what date, what is the emergency plan for that. All these things should be planned. These are the essential components of antenatal care. Okay. Next, we have the last question for today. That is discuss the, sorry, we have 2 more questions, I feel. I remember, if I'm not wrong. No, we have only one question. Discuss the specific health protection given to antenatal causes. Actually, this is a long question. Today it has been asked for a short note, but I'll be discussing more about this so that you will be having a long question answer also. Okay. It has been almost 5 minutes 45 seconds. I'll be ending this first poll in 6 minutes and we'll be starting the second poll. Okay. Discuss the specific health protection given to antenatal cases, that is mothers. What is given? First, we'll see anemia. If the individual is having anemia, if the lady is having anemia, how much anemia and anemic people are there? There are about 50% of the pregnant women are anemic in India, caused by iron folic acid deficiencies. It is not caused by something else. Once there is anemia, there is a high risk of premature birth, postpartum hemorrhage, sepsis, and thromboembolic phenomena in the mother, which are very deadly. First, ending the first poll. And I'll be starting the second one now. Okay, this was I had the second one. I'll give the first one now. These are of 5 questions. Okay, this will be having around 6 minutes for 5 questions. This is the standard time you get in your exams also. Okay, coming to the anemia, back to anemia. Government has initiated a program where 100 mg of elemental iron and 500 micrograms of folic acid distributed daily for 100 days. Okay, 100 mg of elemental iron and 500 mg of micrograms of folic acid for 100 days through antenatal clinics, primary health center, and their subcenters. Other deficiencies like protein, vitamin, mineral deficiency, and iodine deficiency. And in some maternal child health centers, fresh milk is also supplied, which is very difficult. Capsules and vitamin A and vitamin D are also supplied free of cost. Okay, coming to the nutritional, how the nutritional deficiencies are observed, like are being treated. There are certain programs like integrated child development services where the pregnant women and lactating mothers are also given the adequate, like extra nutrition, so that whatever the nutrition they are taking at home is different. Apart from that, they are provided with the ration or the energy foods where the deficiencies are made up. Okay. Next, we have asymptomatic bacteriuria. Once, uh, what we say, bacteriuria or asymptomatic UTI is as usual is common in women. On top of that, it increases during pregnancy. Okay, and this increases the risk for both mother and child. By how? By causing pyelonephritis, preterm birth, low birth weight, increased perinatal mortality, all these things. And because of physiological changes during pregnancy, again, it is the increased risk. How do you diagnose midstream urine culture? Okay, if it is there, please do provide the appropriate antibiotics. Clear this. Gestational diabetes. Mother is screened for her blood sugars during the pregnancy. Okay, why it is screened? Because they have the chances of getting type 2 diabetes in future. If it is not treated, the baby weight increases, which is risk of perinatal mortality. And hyperglycemia, again, it increases the risk of eclampsia, preeclampsia, and miscarriage or stillbirth. Toxemias of pregnancy, diagnosed by albumin in urine, increased blood pressure. Okay, again, they should be treated with appropriate antihypertensives. Tetanus, if the mother was not immunized earlier, sorry, it was not tomorrow's class, it is today's class only. 2 doses of tetanus toxoid, now it is D and T. Okay, should be given the first dose at 16 to 20 weeks and the second dose at 20 to 24 weeks, that is 1 month apart. Okay, if no pregnant women should be denied, it is very wrong to deny. Okay, who has immunized been earlier, 1 booster dose should be provided. Coming to the syphilis, it causes spontaneous abortion, stillbirth, parental birth, birth of a child, and congenital syphilis. That is why syphilis is important. It can cause neurological damage and mental retardation in the newborn. And when the mother is suffering from syphilis, infection of fetus does not occur before 4th month of pregnancy. It is likely to occur after 6 months of pregnancy, by which time Langerhans cells are completely atrophied. That is why the infection starts getting in. Okay. So the mother should be screened for syphilis also. And German measles, again, it is very common. First trimester of pregnancy, abnormalities in infant in 85% of the cases, but detectable 16% are required during second trimester also. Hence, if someone is having measles in the first first trimester of pregnancy, it is very much required that they undergo the test or appropriate diagnostic test to be done for this. Okay, birth defects are uncommon after 20 weeks, but majority are in the first week of pregnancy, first trimester of the pregnancy. RH status, again, when the blood screening is done, the mother's blood group is to be checked and the husband's blood group is also checked and should be recorded. Why? If the father is or the husband is not able to visit during the pregnancy, there are chances the second pregnancy might go for lysis. Okay, fetolysis. If the mother is RH negative and the child is RH positive, it provokes an immune response. Okay, so that she forms antibodies to RH, which can cross the placenta and produce fetal hemolysis in subsequent pregnancy. Sensitization happens in first, destruction happens in subsequent. So both husband-wife blood group and the fetal blood group should be done. And anti-D immunoglobulin should be given at 28 weeks of gestation so that the sensitization during the pregnancy can be prevented. Blood group for all the three. Before delivery, it is for husband and wife. After delivery, for the kid. And if the husband is positive and wife is negative, again, anti-D immunoglobulin. If the RH is positive, D immunoglobulin should be within 72 hours of delivery. It should be given after abortion. Also, HIV infection may pass from infected mother to fetus by delivery or by breastfeeding. So testing should be done and appropriate treatment should be provided. Again, hepatitis B infection, even for carrier of mothers, and prevalence of HBV infection in some regions, and administration of immunoglobulin should be done. Okay. And we have finished the time poll for the second one also. Now we have prenatal genetic counseling. Chromosomal abnormalities are associated with serious birth defects. Okay, so screening should be done for congenital structural anomalies. That is the logic. But is it possible to do for everyone? No. Universal genetic screening is not recommended and practically not possible. Okay, if the mother is a carrier for something, then we can do. Certain tests and certain diagnostic methodologies are available for screening Down syndrome, okay, which have good sensitivity and specificity. They can be done. Okay, screening for chromosomal abnormalities and direct evidence of structural abnormalities can be done if there are risk factors are present. If it is a marriage in the relationship or first order relationship, okay, then the structure of chromosomal abnormalities are little bit higher, risk of those are higher, so they can be done. For hemoglobinopathies and other can be done by biochemical assay, but genetic screening by chromosomal abnormalities, it is very cumbersome and expensive and requires too much of efforts, so they are not recommended as a general screening methods. Okay, with this we'll be concluding our class today. Thanks for watching Auricle. We have social media handles of Auricle in YouTube, Instagram, Facebook, and Telegram. And we have apps for Google Play, on Google Play for Android users and on App Store for iOS users. Please do download and subscribe for Auricle. Use the discount codes for very good discounts. Thanks for watching. See you in the next class.